Now, let's see what are the various factors which facilitate or which reduce bone growth. In this, initially we should talk about hormones. Hormones play a very important role in the regulation of bone health. The various hormones such as growth hormone and thyroid hormones. And in thyroid hormones, both thyroxine and triiodothyronine both are involved in maintaining the growth of the bone. Especially these hormones are essential in infancy and childhood. In such cases, any deficiency of these hormones will lead to defective bone growth, or any excessive release of these hormones will lead to abnormalities in the bone growth. Hence, growth hormone and thyroid hormones are very essential for the growth of the bone. Other hormones which play an important role in bone development are testosterones and estrogens. We know testosterone release during the time of maturation, or especially during adolescence. This spurt of release of testosterone will lead to excessive bone growth, that is, increased activity of epiphyseal cartilage, which also leads to ossification of the bones. Once ossification of this epiphyseal cartilage occurs, this leads to inhibition of bone growth in terms of the height of the bone, whereas the thickness of the bone will continuously be altered throughout the life, whereas the length of the bone will occur a gradual change till the time of puberty. After puberty, we cannot expect any growth in length of the bone, but the bone grows in terms of the thickness. The average increase in length of the bone will be more in terms of men when compared to that of women, because puberty is attained earlier in female than that of in males. Apart from this, estrogen is necessary for the wider pelvis which occurs during the time of puberty. Apart from this, falling estrogen levels after menopause also will lead to bone desorption, leading to weakening of the bones, especially in post-menopausal women. Other hormones such as calcitonin and parathormone, these are also involved in regulating the bone health. Calcitonin is necessary for the absorption of calcium by the bone. This increases the bone calcium level and decreases the blood calcium level. Whereas parathormone, it is involved in reducing the bone calcium and increasing the blood calcium. Hence, both calcitonin and parathormone, these are involved in regulating the blood calcium and also the bone calcium levels. Although the length of the bone does not increase after puberty, there is a constant change in the thickness of the bone. So this is due to the osteoblasts will keep on secreting new osteons in the peripheral layers of compact bone, whereas the osteoclast will lead to constant remodeling or reduction or absorption of this osteoid. Now let's see what is the influence of exercise on bone growth. We have seen that the thickness of the bone is continuously altered, and this will be facilitated by weight bearing exercises. So increase in activities such as weight bearing exercises will lead to strengthening of the bones. So this leads to excessive production of osteons, leading to increase in thickness of the bones. So weight bearing exercises will lead to formation of thickened and strong bones. In the same way, the opposite occurs in the case of lack of physical activity. In this case, this leads to formation of lighter and weaker bones. Next we will see what is the role of diet on bones. Bones require adequate amount of calcium and some vitamins such as vitamin A, vitamin C and vitamin D. Apart from this, it also requires iron, phosphate and manganese, which help in mineralization of the bone. Vitamin A is necessary to regulate the osteoblasts activity, whereas vitamin C is necessary for the production of collagen, and vitamin D, it is necessary for absorption of calcium and phosphate from the intestinal diet. In this way, there are various factors, both hormonal factors, exercise and dietary factors, which involve in regulation of the bone growth. Now, let us see various terms which we will be coming across during the study of skeletal system. The first is articulating surface. It means the part of the bone that enters into the formation of a joint is called as the articulating surface of that particular bone. And articulation is nothing but a joint between two or more bones. Bony sinus. This is a hollow cavity within a bone, whereas border of a bone is nothing but a ridge of a bone that separates two surfaces of a bone is called as border of that bone. Whereas a condyle is a smooth rounded projection of a bone that forms part of a joint. A facet is small and generally flat surface which forms an articulating surface of that particular bone. Fissure or cleft is a narrow slit which is visible on the bone. Foramen or foramina is a hole in the bone. Generally, foramens allow the passage of blood vessels, nerves through the bone. Fossa, which is also called as fossae plurally, is nothing but a hollow region of a bone or a depression in the bone is called as fossa. Meatus is a tube shaped cavity within a bone. A septum is a partition which separates two cavities. Spine or spinous process or crest is a sharp ridge of the bone, or we can call it as a sharp projection. Styloid process is a sharp downward projection of a bone that gives attachment to the muscles and the ligaments. Suture is a immovable joint between the bones of the skull. Tuberosity or tubercle is a bony projection which gives attachment to the muscles or ligaments. The largest of such bony projections are called as trochanters, and the smallest of them are called as tubercles. Now let's start with the study of skeletal system. In skeletal system, we have seen we will be studying about different types of bones of the body, and here we can broadly classify all the bones of skeletal system into two groups. They are axial skeleton and appendicular skeleton. Axial skeleton, it forms the core of the body, or we can call it as it forms the axis of the body, whereas appendicular skeleton is attached to the core or is attached to the axis. Hence, we can call it as the bones of appendicular skeleton are appended, or we can call them as attached to the axis. So all the bones can be classified into two groups. They are axial skeleton and appendicular skeleton. Now let's see what are the various bones which are categorized under axial skeleton and which are categorized under appendicular skeleton. We will start with axial skeleton. Axial skeleton, it consists of skull, vertebrae, sternum, ribs. These are the bones which we will be studying under axial skeleton. Skull, vertebrae, sternum and ribs. Now let's see them in detail. After which we will be studying about the bones of appendicular skeleton, which are nothing but those which are attached to this axial skeleton. Under that you will be studying the shoulder girdle, pelvic girdle and bones of upper limbs and lower limbs. In axial skeleton, first we will be studying about skull. Skull consists of various flat and irregular bones, and the bones of the skull can be categorized into two groups: bones of cranium and bones of face, or we can also call them as cranial bones and facial bones. Apart from this, we can also find this hollow cavities called as sinuses in the bones of skull. We have seen in the terminologies that sinuses are nothing but they are hollow cavities which are found within the brain, and these hollow cavities can be found in the skull bones which form sinuses. They are frontal sinuses, ethmoid sinus, sphenoid sinus and maxillary sinus. These are the four different sinuses which can be found in the skull: frontal, ethmoid, maxillary and sphenoid sinuses. And all these sinuses are lined with ciliated mucous epithelium, and these are connected to the nasal cavity. The role or function of these sinuses is they are essential for resonating the voice, and also they are involved in reducing the weight of the skull so that it can be maintained without any much effort. Now let's see the bones of skull. We have seen the bones of skull can be categorized into two groups. They are cranial bones and facial bones. We will start with cranial bones. There are 8 cranial bones. They are 1 frontal bone, 2 parietal bones, 2 temporal bones, one occipital bone, one sphenoid bone, and one ethmoid bone. You can count these 8. One frontal bone, 2 parietal bones, 2 temporal bones, 1 occipital bone, 1 ethmoid bone, and 1 sphenoid bone. Now let's see about this frontal bone. Frontal bone is the bone of forehead, and this frontal bone initially it emerges as a pair of bones, and after birth these bones together are conjoined to form a single bone called as frontal bone, and we can find various joints in the mature cranial bones, and these joints are called as sutures. The joints of cranial bones are called as sutures, and these joints are immovable. We can find this as an question. What are the immovable joints called as? The frontal bone, it emerges as 2 bones and which are fused together with a frontal suture after birth. And the frontal bones also forms a part of orbital cavities in which our eyes rest in. That orbital cavity is also a part of the frontal bone. Apart from this, we can also find the most prominent ridges, which are called as supraorbital margins. They also are part of frontal bone. And we have seen that frontal bone consists of a sinus, which is nothing but frontal sinus, which communicates with the nasal cavity. Frontal bone, it forms a suture with the adjacent parietal bones, with sphenoid bone, with ethmoid bone, with lacrimal bones, with nasal bones, and with the zygomatic bones. You can find that this frontal bone, it forms a joint with the parietal bones, ethmoid bone, sphenoid bone, lacrimal bones, nasal bones, and zygomatic bones. The other bones of cranium are parietal bones. We have seen the frontal bones, it forms the forehead, whereas the parietal bones, it forms the roof of the skull. And these parietal bones, they form a suture with the frontal bone, and this suture is called as coronal suture. Whereas the 2 parietal bones, they are joined with each other by a suture called as sagittal suture, and this parietal bone also forms a suture with that of occipital bone, and this is called as lambdoidal suture. And these bones also form a suture with temporal bones with a suture called as squamous suture. The inner surface of these parietal bones is hollow, and this accommodates the brain. The other cranial bones are temporal bones. We have seen the parietal bone, it forms the roof of the brain, whereas the temporal bone, it forms the sides of the brain. And these temporal bones will form articulation or will form joints with that of parietal bones, occipital bones, sphenoid bones, and zygomatic bones. We will see them in detail. The temporal bones have a flat surface which is called as squamous portion, and this squamous portion, it forms a squamous suture with that of parietal bones. They have a mastoid process. This is a thickened region which can be felt behind the ear, and this mastoid process has many sinuses, and these sinuses, they are lined with squamous epithelium, and they are connected to the middle ear. The petrous portion of temporal bone, it also forms the base of the skull, and in this portion lies the organs of hearing, especially the spiral organ and also the organs of balance. The temporal bone articulates with the zygomatic bone. The temporal bone has an zygomatic process which forms this articulation with the zygomatic bone, and this zygomatic process of temporal bone and the zygomatic bone of facial bone together they form an arch, or which is also called as zygomatic arch, or the cheek prominence which we can feel. Temporal bone also forms a joint with the mandible and at a region called as temporomandibular joint, and this is the only movable joint in the skull. Immediately behind this temporomandibular joint there is a hollow tube called as external acoustic meatus, so which opens into the middle ear. There is a sharp downward projection in the temporal bone which is called as styloid process, and this styloid process gives attachment to the muscles of tongue, hyoid and pharynx, and this is regarding the temporal bone. Now let's see about the occipital bone. Occipital bone forms the posterior of the cranial bones, and it also forms the base of the cranium. It forms the back of the cranium and also a part of the base of the cranium, and this occipital lobes of the cerebrum and the cerebellum, they lie in the deep depressions which are present in this occipital bone, and this occipital bone has a region called as occiput, which consists of two condyles and a large foramen, and these two condyles they form a joint with that of the first vertebrae which is called as atlas, and this joint is a type of condyloid joint and is necessary for the nodding movements of the head, and the foramen which is present between these two condyles is called as foramen magnum, and this is the opening through which the spinal cord leaves the brain into the vertebral column. Occipital bone, it forms a suture with that of temporal bones, parietal bones and sphenoid bones. Next, we will see the other bones of cranium, that is sphenoid bone. We have seen that there is one sphenoid bone, and this sphenoid bone, it forms the middle portion of the base of cranium, and this sphenoid bone, it forms joints with that of occipital bone, temporal bone, parietal bones and ethmoid bones. Sphenoid bone also consists of sinuses, and this sinuses will lead into the nasal cavity, and they are lined with ciliated mucous epithelium. And this sphenoid bone, it links the facial bones with that of cranial bones, and at the base of the sphenoid bone we can find a fossa or a depression which is called as hypophyseal fossa, and this is the region in which the pituitary gland lies in. There are optic foramina in anterior region of this sphenoid bone, and through which the optic nerves pass from the orbital cavity into the brain. Next we will see the other bone of cranium, that is ethmoid bone, and this ethmoid bone, it forms the anterior portion of the base of the skull. So we have seen that the three bones are involved in the formation of base of the skull, that is occipital bone, sphenoid bone and the ethmoid bone. Occipital bone, it forms the posterior region of the base of the skull. Sphenoid bone, it forms the middle portion of the base of the skull, and ethmoid bone, it forms the anterior region of the base of the skull. And this ethmoid bone, it also forms a part of the orbital cavity, and ethmoid bone is the delicate bone which also has various sinuses called as ethmoid sinuses, which open into the nasal cavity, and these are also lined with ciliated mucous epithelium. The anterior region of ethmoid bone also, it forms the upper part of nasal septum. Ethmoid bone also forms the lateral walls of the nasal cavity, and we can find two projections in these lateral walls which are called as superior concave and middle concave, and these projections are also called as turbinated processes, and the arrangement of these processes will increase the turbulence of the air that is inhaled into the nasal cavity. And ethmoid bone also has a perforated plate which is called as cribriform plate, and this perforated cribriform plate, it forms the roof of nasal cavity, and olfactory nerves pass through these perforations of the cribriform plate of ethmoid bone. These are the bones of cranium. We have seen about one frontal bone, two parietal bones, one occipital bone, two temporal bones, one sphenoid bone and one ethmoid bone.